let's suppose this person has complaint of tingling, numbness below the knee joint bilaterally, and on examination you find that pain, temperature, vibration, proprioception, all types of sensation is lost below the knee joint. So can this problem be due to pathology in the spinal cord or in the brain, or is it just peripheral neuropathy only? So can you say from this only? If the sensation is lost below the knee joint and there is no loss of motor power, so it is peripheral neuropathy only. There is no problem in the spinal cord or brainstem or cortex. So how can you say like that? So to understand that, let's understand the diagram of a spinal cord. So let's suppose this is the spinal cord and this is at lumbosacral level. Let's assume this is the spinal cord, and at this portion you know that there are multiple nerve fibers exiting in the lumbosacral region that makes lumbosacral plexus, and then one fiber is femoral nerve, another continues backward as sciatic nerve, and in back it continues as sciatic nerve, and at knee it divides into common peroneal nerve, superficial peroneal nerve, and then tibial nerve. Similarly on this side, anteriorly comes femoral nerve and posteriorly goes sciatic nerve. At knee joint it divides into common peroneal, superficial peroneal, and tibial nerve. So these are the major nerve fibers. So he has problem below this, below the knee joint, sensation loss. So if there was problem in the spinal cord, either any types of pathology like demyelinating or degenerative or vascular accident or traumatic, any kind of pathology, if it was in a spinal cord, then whole this tract would be involved. So he would also have loss of power in the anterior thigh muscles and in the leg as well, because this tract, this nerve is not just limited to here, it is directly connected via sciatic nerve, femoral nerve. Okay, so if it was pathology in the spinal cord, it would involve the whole tract, but he has problem only limited below the knee joint. So that's why we can tell this, the pathology is limited to the peripheral nerves only, here only. And if you see just one nerve like either common peroneal or superficial peroneal, tibial nerve, so inside that nerve there are multiple nerve fibers, just like inside the wiring of your house there is outside insulator, plastic covering, and inside there are multiple nerve fibers. So similarly there are multiple nerve fibers inside the one nerve fiber, either sciatic nerve or tibial nerve. So let's suppose one fiber is of sympathetic supply, another is of parasympathetic supply, another is of pain, temperature, another is of proprioception, vibration, another controls motor action. So there are multiple nerve fibers and each has separate job, and some fibers are myelinated, like motor fibers, you see these are myelinated, and these proprioception fibers are also myelinated, but pain, temperature are not myelinated. So some fibers are myelinated, some are not myelinated, but these are all fibers are packed inside one nerve fiber. So if there is any pathology like due to any toxins or any heavy metals ingestion, heavy metals, what happens that this damages these nerve fibers. So some toxins damages sensory fibers first, some damage motor fibers first, but in the long run it damages the whole nerve fibers. Similarly in vitamin B12 deficiency, Initially, it affects these myelinated nerve fibers. So, patient might have loss of proprioception, vibration, and in diabetic neuropathy also you might have heard that first of all vibration sensation is gone. So initially these large fibers, large fiber means they have classified the fibers based on the diameter of those nerve fibers. So these proprioceptive fibers are vibration carrying fibers are have large diameter. So initially these fibers are affected. So but ultimately other fibers can also be affected, like even pain temperature can be gone in the long run, and in the long run motor fiber also can be gone. And you might have heard one conditions called acute inflammatory demyelinating polyneuropathy or GBS, Guillain-Barré syndrome. In that you might have seen that motor is also gone and sensation is least affected, but it is not that its sensation is not involved, but generally motor is gone. So in that condition generally that demyelination affects these motor fibers. These motor fibers are also heavily myelinated, and it is a demyelinating disease. In that condition motor is gone, but sensory is least gone because those are not affected. And which disease or which toxins affects which nerve fibers predominantly, this is unclear. But some have predilection for this and some have predilection for that. It is not, you cannot definitely tell that vitamin B12 only damages these nerve fibers and spares this and that. This is not like that, but some have predilection for that. And in demyelinating disease, either CIDP, AIDP, demyelinating fibers are affected first. Demyelinating means I mean to say that myelinated fibers are affected first, like motor fibers, the fibers of this proprioception, vibration.